We wanted to hold this program yesterday on April 15th because then we really would have had a twofer, death and taxes. But we're holding it today. And this isn't really about death, but it's in a sense like taxes. You have to do something about it, but you can do it with grace and dignity, or you can do it without grace and without dignity. And this is about advanced directives. The handout is in front of you. It is, what I'm going to say is directly based on what's in that handout. Remember, advanced directives are legal documents that allow you to convey your decisions about end-of-life care. They provide a way for you to make your wishes known to others and to professionals when you are unable to communicate. Advanced directives comprise two separate parts. One is a living will, and one is called a durable power of attorney for health care. Why do you need them? If you can't talk, if you can't interact with your environment, how will you get your wishes expressed? And if you have family members who have different ideas about what to do about you or your spouse or your partner or someone else, it can be extremely difficult for everybody, including the practitioners. I'm a physician, and when families are squabbling about what to do, it can get mighty unpleasant. When do advanced directives go into effect? When you can't speak for yourself, when a physician determines that you really can't do it. And this is often at an end-stage medical situation or when you're unconscious for a protracted period. Remember, I said there are two parts. One is a living will. A living will constitutes a way of you're talking about yourself and what you want done with respect to your care in a perhaps terminal situation. It outlines the extent and type of medical intervention which you wish. And living wills address many issues: dialysis, breathing machines, resuscitation, tube feeding, organ or tissue donation. By the way, and this is a point here, and I know Willo Carey will be talking about this, your doctor and you should be in agreement on what your living will says. If he, she, your practitioner is not comfortable with that, then there's an issue, and you should discuss this. Second document was a durable power of attorney. It's a proxy. In other words, you can't speak for yourself, so you're giving that authority to someone else, someone you trust. And it has to be someone whose beliefs are consonant with you. So the question is, how do you get these? You can use an attorney, of course. But you can also, under Pennsylvania law, use a piece of paper, get a form at a stationery store, certainly go online and get something. And you have to sign it in front of two adults. And it stays into effect until you change it. You then have to give it to people. I will tell an anecdote about myself. I'm not proud of this. I was discussing with my wife last weekend that we were going to do a program here on advanced directives. We both have them. And then she very sweetly, she's from the Midwest, she's very sweet. She looked at me and said, "But darling, yours are in the new locking safe, and you changed the key, and I don't have a copy." Oh, okay. Guess what we're doing this weekend as far as getting keys. So you need a copy of these. You have to have a copy to someone who can be useful to you. Your physician can have it, and you have to make your close relatives aware of it. I ran through this. It's there in hard copy for you. The discussion this morning will be about this and some of the ramifications from this. I think we're very fortunate to have Willo Carey here from WHYY to moderate this morning show, and thank you. And I hope you learn a lot, and I hope you do something with what you learned this morning.
Thank you very much, George. Well, today's program is entitled, As We Live and Die, Preparing Your Own Personal Health Care Agenda. And the topic is that oft-forgotten item of advanced directives. Just curious, how many of you already have one? Great, a few. And well, as we'll see, these are important at any age, not just if you're elderly. I don't know if you heard the news this morning driving in. I heard the announcement that the president issued a memorandum today to ensure that all hospitals participating in Medicare and Medicaid are in full compliance with regulations codified to guarantee that all patients' advance directives are respected. There are new guidelines coming out for how hospitals can best comply with the regulations. So that's, I think, great news. And today it's very appropriate. Anybody know what today is? April 16th? No? It's National Healthcare Decisions Day. This is the day to talk to others about your future healthcare decisions and to complete your advance directives. So you've come to the right place. Before we begin, I'd like to thank our sponsors whose support made the event possible. In conjunction with National Healthcare Decisions Day, the event is sponsored by, of course, the College of Physicians of Philadelphia, phillyhealthinfo.org, where you'll find, I hope you go there for all of your information on health and medicine. Handouts are going to be posted at that website. Also, the Delaware Valley Healthcare Council, the Free Library of Philadelphia, DocuBank, AARP Pennsylvania, and WHYY and its Caring Community Coalition. And I was pleased to see some members of that. Well, WHYY is very pleased to be part of this event. As you may recall, back in 2001, we broadcast On Our Own Terms. This was Bill Moyer's landmark series on death and dying. And many of you, such as the Free Library of Philadelphia, their hospitals, hospices, joined with us in creating what turned out to be the most successful outreach in the history of public television, and it was around that series. Bill Moyers considered the topic the last taboo in America, and he wanted to inspire conversations within families, with physicians, other providers, to really ensure that all of us can die on our own terms. Unfortunately, there's still such reticence about the topic of death, and people continue to die in pain, and not just physical, but psychosocial and spiritual. I remember when the question of a feeding tube came up for my mother, her physician said, absolutely not. Psychologically, it would be the death of her. And I thought, wow, he really knows my mother. I asked her once what her pain level was on that 1 to 10 pain scale. She said 100. I said, is it physical? She said, no, psychic. And as far as she was concerned, she didn't want anything that was going to delay her departure. But I don't know if you read in the April 3rd New York Times, it was the story of a palliative care doctor who was diagnosed with cancer and wanted everything done right up till the end. And this was contrary to the advice of a peaceful death that she was giving her clients and her patients. And her mentor, another doctor, Pecker, said, I think that how you want to live and what you choose to do is different than what you might recommend to someone else. So all of us, especially those of us who are in the field perhaps, even if you think you'd know what you would recommend, when it comes to you, that may be something else. And I think this is an opportunity today to really think personally about what you would do and honor that as well for other people. So we hope today's discussion is going to inspire communication. And this is something that is so necessary and often so lacking in making our wishes known.